You have recently been diagnosed with cancer and your doctor has recommended chemotherapy, a term that may be very new to you. Chemotherapy, referred to as chemo, is a type of cancer treatment that uses drugs to destroy cancer cells. This video will provide you with an overview of the chemotherapy treatment process. The Cancer Center of Western Wisconsin was developed in order to provide cancer care and treatment for patients close to home. It is a partnership made up of 6 regional hospitals: Amory Hospital and Clinic, Hudson Hospital and Clinic, Osceola Medical Center, St. Croix Regional Medical Center, St. Croix Regional Medical Center Frederick Clinic, Western Wisconsin Health, and Westfields Hospital and Clinic. The Radiation Therapy Center of Western Wisconsin is also a part of the unique partnership and provides radiation treatment in New Richmond, Wisconsin. How does chemotherapy work? Chemotherapy works by stopping or slowing the growth of cancer cells. We know that cancer cells grow and divide quickly, and chemotherapy acts on these quickly dividing cells. Other normal, healthy cells also grow and divide quickly, and chemotherapy can also affect these healthy cells in common locations like the mouth, intestinal tract, or hair. It can also cause other unwanted side effects. Often after your chemo treatment is completed, side effects get better and go away. Depending on your type of cancer and how advanced it is, chemotherapy can cure cancer, control cancer, and ease cancer symptoms. Chemotherapy can be used with the intention of curing cancer to kill all the microscopic cancer cells so they do not grow back in a local or distant location. Chemotherapy can also be used to control cancer and symptoms from it, also known as palliative chemotherapy. In many cases, surgery, radiation therapy, or biological therapy may be recommended in addition to your chemo as part of your treatment process. How is chemo given? You may receive chemotherapy in several ways. Injection, a shot given in a specific location. Intravenous, chemo is administered directly into the vein through an IV. Topical, a cream you put on your skin. Oral, pills, capsules, or liquids you swallow. During treatment, you may experience various side effects caused by chemotherapy. Not everyone experiences each side effect, so make sure to speak with your nurse or provider about the side effects you are feeling. In this video, we will discuss the common side effects and give you tips to help manage them. Nadir and infection. After beginning your chemotherapy treatment, your infection-fighting white blood cells can drop to a low point, which is known as nadir. This typically occurs 7 to 14 days after your chemo treatment. This is a critical time for you to protect yourself from infection and will require you to closely monitor your symptoms. If you have a fever greater than 100.5, please notify your provider or nurse right away. Nausea and vomiting. Some types of chemotherapy may cause nausea and vomiting. If you are receiving a medication that can cause these side effects, your provider will prescribe medications to prevent it. Hair loss. If hair loss is expected with your type of chemotherapy, your provider and nurse will let you know, as it will typically occur 2 to 3 weeks after your first treatment. Many patients will wear a hat or scarf, and there are hats available at no cost at each location. Other side effects of chemotherapy include fatigue, may make you feel weak, weary, worn out, heavy, or slow. Neuropathy, numbness and/or tingling that may occur in your hands or feet, making it difficult to grasp items or find balance. Chemobrain, it may cause difficulties with memory, learning, and thinking. If you are experiencing any of these side effects or other ailments, please speak with your nurse or doctor, as we have a variety of ways to help you manage the changes you may be facing during your treatment. At some point during chemotherapy, you may feel anxious, depressed, frustrated, or helpless. We have counselors available to help you cope with these feelings. We are here with you every step of the way and want to prevent and ease your side effects as best as possible. To learn more about chemotherapy treatment at any Cancer Center of Western Wisconsin location, visit our website at cc-ww.org or speak with your local care team to discuss questions you may have. Contact information for your clinic will be provided at your first appointment. The content of this video was sourced from the National Cancer Institute, the U.S. government's principal agency for cancer research.